Have you ever felt your legs getting weaker, making everyday tasks like climbing stairs or even just standing up feel more challenging? As we age, maintaining leg strength is crucial for our independence, balance, and overall quality of life. But did you know that some common habits and overlooked factors could be silently sabotaging your leg power? You need to watch this video until the very end because we're diving deep into the 7 critical mistakes that doctors warn are actively destroying your leg strength. Identifying and addressing these issues now can be the key to staying strong, mobile, and enjoying an active life for years to come. Don't let these silent threats weaken your foundation. Discover what they are and, more importantly, what you can do about them. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 1. Prolonged sedentary behavior and lack of physical activity. The problem: extended periods of sitting, reclining, or lying down without engaging in physical activity are among the leading causes of muscle weakening, particularly in the lower extremities. Sedentary behavior causes muscles to remain underutilized, leading to atrophy, a process where muscle mass and strength diminish over time. This issue is especially critical for older adults, as age-related muscle loss, known as sarcopenia, accelerates after the age of 60. Sarcopenia can severely compromise leg strength, which is vital for maintaining mobility, balance, and independence. Weak leg muscles increase the risk of falls, a major concern for seniors, as falls can lead to fractures, hospitalizations, and a decline in overall quality of life. Why it's destructive. Muscles require consistent mechanical stimulation through movement to preserve their size, strength, and functionality. When physical activity is minimal or absent, the body receives fewer signals to maintain muscle tissue, triggering a cascade of physiological changes. Muscle protein synthesis declines, and muscle fibers, particularly the fast-twitch fibers responsible for power and strength, begin to shrink. Over time, this results in reduced muscle mass, diminished strength, and impaired physical performance. Beyond the legs, prolonged inactivity can contribute to systemic health problems, including cardiovascular disease, insulin resistance, obesity, and metabolic syndrome, all of which exacerbate muscle weakness and overall physical decline. What doctors advise. To counteract the effects of sedentary behavior, doctors strongly recommend incorporating regular physical activity that targets the leg muscles. Weight-bearing exercises, such as brisk walking, hiking, or climbing stairs, help stimulate muscle growth and improve endurance. Resistance training, which includes exercises using free weights, resistance bands, or body weight, e.g., squats, lunges, or leg presses, is particularly effective for building and maintaining muscle strength. For seniors, even low-impact activities like chair exercises or water aerobics can be beneficial. Doctors also emphasize the importance of breaking up prolonged sitting with short bouts of movement throughout the day, such as standing, stretching, or walking for 5 to 10 minutes every hour. A physical therapist or certified trainer can design a tailored exercise program that accommodates individual fitness levels and health conditions, ensuring safety and effectiveness. 2. Poor nutrition, especially insufficient protein intake. The problem: muscles are predominantly composed of protein, and adequate dietary protein is essential for muscle repair, maintenance, and growth. As people age, their bodies become less efficient at synthesizing muscle protein, a condition known as anabolic resistance. This makes consuming sufficient high-quality protein even more critical for seniors to preserve muscle mass. Inadequate overall calorie intake can also contribute to muscle breakdown, as the body may break down muscle tissue to meet energy demands. Additionally, deficiencies in key nutrients, such as vitamin D, calcium, or omega-3 fatty acids, can further impair muscle function and exacerbate weakness. Why it's destructive. Without sufficient protein, the body lacks the essential amino acids needed to repair microtears and muscle fibers caused by daily activities or exercise. This hinders muscle maintenance and accelerates age-related muscle loss, making it harder to regain strength even with physical activity. Inadequate protein intake also impairs the body's ability to recover from exercise, reducing the effectiveness of strength training programs. Furthermore, deficiencies in micronutrients like vitamin D, which supports muscle contraction and strength, or magnesium, which aids in muscle relaxation, can compound muscle weakness and increase the risk of cramps, fatigue, and injury. What doctors advise? Doctors recommend a nutrient-dense, balanced diet that prioritizes lean, high-quality protein sources, such as fish, e.g., salmon, tuna, poultry, eggs, legumes, e.g., beans, lentils, chickpeas, tofu, Greek yogurt, and low-fat dairy. For seniors, aiming for 1.0 to 1.2 grams of protein per kilogram of body weight daily is often advised, though individual needs may vary based on activity level and health status. Spreading protein intake evenly across meals can optimize muscle protein synthesis. Adequate calorie intake is also crucial to prevent the body from catabolizing muscle tissue for energy. To ensure proper nutrition, consulting a registered dietitian or nutritionist can be invaluable. They can assess dietary habits, recommend meal plans, and suggest supplements if necessary, such as vitamin D or protein powders for those struggling to meet their needs through food alone. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 3. Ignoring pain and avoiding movement due to discomfort. The problem. Many seniors experience joint pain, stiffness, or discomfort due to chronic conditions like osteoarthritis, rheumatoid arthritis, or tendinitis. While it's instinctive to avoid activities that cause pain, completely refraining from movement can worsen the problem over time. Inactivity weakens the muscles that support and stabilize joints, reducing their ability to absorb shock and maintain proper alignment. This creates a vicious cycle where muscle weakness leads to increased joint instability, which in turn causes more pain and further limits mobility, ultimately threatening independence. Why it's destructive. Avoiding movement due to pain accelerates muscle atrophy, particularly in the muscles surrounding affected joints, such as the quadriceps, hamstrings, and calves in the legs. Weak muscles provide less support to joints, increasing stress on cartilage, ligaments, and tendons, which can intensify pain and inflammation. Over time, this cycle can lead to significant functional limitations, making it difficult to perform daily tasks like walking, climbing stairs, or standing up from a chair. In severe cases, it can contribute to a loss of independence and a higher risk of falls and injuries. What doctors advise? Addressing the root cause of pain is critical, and doctors urge patients to seek medical evaluation rather than ignoring discomfort. A healthcare provider may recommend diagnostic tests, e.g., X-rays, MRIs, to identify the underlying condition and develop a targeted treatment plan. Pain management strategies may include medications, e.g., anti-inflammatories, analgesics, corticosteroid injections, or alternative therapies like acupuncture. Physical therapy is often a cornerstone of treatment, as it involves tailored exercises to strengthen the muscles around affected joints, improve flexibility, and enhance joint stability. For example, low-impact exercises like swimming or stationary cycling can maintain muscle strength without overloading painful joints. In some cases, assistive devices like braces or orthotics may be recommended to support mobility. Working with a physical therapist ensures that exercises are performed safely and progressively, minimizing discomfort while maximizing benefits. 4. Dehydration. The problem. Water is vital for nearly every physiological process, including muscle function, as muscles are composed of approximately 75% water. Dehydration impairs muscle performance, leading to fatigue, cramping, and reduced strength. Seniors are particularly vulnerable to dehydration because the body's thirst mechanism weakens with age, and certain medications, e.g., diuretics, can increase fluid loss. Chronic mild dehydration, even if not immediately noticeable, can have cumulative effects on muscle health and physical function. Why it's destructive. Dehydration disrupts the body's ability to deliver nutrients, such as glucose and electrolytes, to muscle cells and remove metabolic waste products, like lactic acid, that accumulate during activity. This impairs muscle contraction, endurance, and recovery, making physical tasks feel more strenuous and increasing the risk of cramps or injury. Over time, chronic dehydration can contribute to muscle weakness and a decline in overall physical performance, compounding the effects of other risk factors like inactivity or poor nutrition. What doctors advise? Maintaining proper hydration is essential for supporting muscle health and overall well-being. Doctors recommend drinking water consistently throughout the day, rather than waiting to feel thirsty. A general guideline is to aim for 8 to 10 cups, 64 to 80 ounces, of fluid daily, though individual needs vary based on body size, activity level, climate, and health conditions. Foods with high water content, such as fruits, e.g., watermelon, oranges, and vegetables, e.g., cucumber, celery, can also contribute to hydration. During physical activity or in hot weather, fluid intake should be increased to replace losses from sweat. For seniors with medical conditions like kidney disease or heart failure, fluid needs should be discussed with a doctor to avoid complications. Using reminders, such as setting alarms or keeping a water bottle nearby, can help establish a routine of regular hydration. 5. Certain medical conditions and medications. The problem: a variety of medical conditions can directly or indirectly impair leg muscle strength and function. For example, diabetes can cause peripheral neuropathy, leading to nerve damage that disrupts muscle activation. Thyroid disorders, such as hypothyroidism, can slow metabolism and reduce muscle energy production. Cardiovascular diseases, like peripheral artery disease, can limit blood flow to the legs, causing weakness and fatigue. Additionally, certain medications, such as statins, used for cholesterol management, corticosteroids, or diuretics, may have side effects that include muscle weakness, cramps, or fatigue, further complicating muscle health. Why it's destructive. These conditions disrupt critical processes that support muscle function, such as nerve signaling, blood supply, and energy metabolism. For instance, peripheral neuropathy can impair the brain's ability to communicate with leg muscles, reducing coordination and strength. Poor blood flow from cardiovascular issues starves muscles of oxygen and nutrients, leading to fatigue and weakness. Medications, meanwhile, can interfere with muscle protein synthesis, electrolyte balance, or mitochondrial function, all of which are essential for maintaining muscle health. Left unaddressed, these factors can significantly impair mobility and increase the risk of falls and disability. What doctors advise: effective management of underlying medical conditions is crucial for preserving muscle strength. This includes regular medical checkups, adherence to prescribed treatments, and lifestyle modifications to control conditions like diabetes or hypertension. For example, maintaining stable blood sugar levels through diet and medication can minimize nerve damage in diabetic patients. If muscle weakness or fatigue emerges after starting a new medication, patients should promptly consult their doctor. The physician may evaluate whether the medication is contributing to the symptoms and consider adjusting the dosage, switching to an alternative drug, or implementing strategies to mitigate side effects. In some cases, physical therapy or nutritional interventions may be recommended to support muscle health. Open communication with healthcare providers ensures that any changes in muscle function are addressed promptly and comprehensively. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 6. Poor footwear and lack of attention to foot health. The problem: the footwear you choose daily serves as the critical foundation for your body's movement, directly influencing the health of your feet, legs, and overall musculoskeletal system. Wearing ill-fitting, unsupportive, or inappropriate shoes, such as those that are too tight, too loose, lack adequate arch support, or have worn-out soles, can profoundly disrupt your natural gait, compromise balance, and alter the biomechanical engagement of your leg muscles. For instance, high heels may shift weight unnaturally onto the forefoot, while flat, unsupportive sandals may fail to absorb shock or stabilize the foot. Beyond footwear, untreated foot conditions, such as bunions, corns, calluses, plantar fasciitis, or neuromas, can cause persistent pain and inflammation, forcing you to modify how you walk or stand to minimize discomfort. These compensatory movement patterns, whether subtle or pronounced, can lead to uneven muscle use in the legs, gradually weakening specific muscle groups like the quadriceps, hamstrings, or calves. Over time, this contributes to reduced leg strength, impaired mobility, and an increased risk of injury. Why it's destructive: the feet are the body's primary point of contact with the ground, and any dysfunction in their structure or support can create a cascade of negative effects throughout the lower body. When footwear fails to provide proper cushioning, stability, or alignment, or when foot pain forces you to adjust your walking style, certain leg muscles are subjected to excessive strain while others are underutilized. For example, compensating for plantar fasciitis pain might cause you to favor one leg or walk on the outer edges of your feet, overworking muscles like the peroneals while neglecting others, such as the tibialis anterior. This imbalance disrupts the harmonious interplay of muscle groups required for strong, efficient movement. Over time, these imbalances can lead to chronic muscle weakness, joint stress, and a higher likelihood of injuries, such as shin splints, knee pain, or ankle sprains. Furthermore, poor foot health can exacerbate existing conditions, like arthritis or diabetic neuropathy, amplifying discomfort and further limiting mobility. The cumulative effect is a weakened lower body, diminished stability, and an elevated risk of falls, particularly in older adults. What doctors advise: to safeguard your leg strength and overall mobility, prioritize footwear that is meticulously designed to support the unique structure and needs of your feet. Opt for shoes that offer a proper fit, with enough room for toes to move, robust arch support, adequate cushioning, and a stable sole to absorb impact. Replace worn-out shoes regularly, as degraded cushioning or soles can no longer provide the necessary support. For individuals with specific foot issues, such as flat feet, high arches, or bunions, consulting a podiatrist is essential. A podiatrist can conduct a thorough assessment, which may include gait analysis or imaging, to diagnose underlying conditions and recommend tailored solutions, such as custom orthotics, physical therapy, or corrective exercises. Incorporate foot strengthening exercises into your routine, such as toe curls, arch lifts, or picking up small objects with your toes, to enhance muscle tone and flexibility. Stretching the calves, Achilles tendon, and plantar fascia can also improve mobility and reduce tension. Maintain proper foot hygiene to prevent infections or complications, especially if you have diabetes or circulatory issues. If you experience persistent foot pain, swelling, or structural changes, seek professional care promptly to prevent compensatory patterns from taking hold. By investing in high-quality footwear, addressing foot problems proactively, and maintaining diligent foot care, you can ensure optimal biomechanical alignment, reduce strain on your leg muscles, and preserve strong, functional legs for years to come. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 7. Ignoring early warning signs of weakness or balance issues. The problem: the gradual onset of leg weakness or balance issues is often so subtle that it goes unnoticed or is mistakenly attributed to the natural aging process. Many individuals dismiss early indicators, such as slight difficulty rising from a low chair, needing to grip handrails while climbing stairs, or feeling unsteady when walking on uneven surfaces. Other signs, like frequent tripping, a sense of heaviness in the legs, or occasional stumbles, may be brushed off as temporary or insignificant. This tendency to ignore or downplay these symptoms delays critical opportunities for intervention, allowing muscle weakness and balance impairments to progress unchecked. As a result, individuals face a heightened risk of falls, injuries, and a significant decline in functional independence, which can profoundly impact their quality of life and ability to perform daily activities. Why it's destructive. Recognizing and addressing early signs of leg weakness or balance problems is paramount because timely intervention can halt or even reverse the progression of these issues. For example, targeted strength training, balance exercises, or physical therapy can rebuild muscle mass, enhance coordination, and restore confidence in movement. Additionally, early medical evaluation can uncover underlying causes of weakness or instability, such as vitamin B12 deficiency, peripheral neuropathy, thyroid dysfunction, or neurological conditions like Parkinson's disease. Ignoring these warning signs postpones treatment, allowing muscle atrophy and balance deficits to worsen. This delay makes it exponentially harder to regain lost strength, as muscles lose their ability to respond to exercise over time. Furthermore, untreated weakness and instability increase the likelihood of falls, which can result in fractures, head injuries, or a fear of falling that leads to reduced physical activity. This creates a vicious cycle of further muscle loss, diminished mobility, and social isolation, ultimately eroding independence and overall health. What doctors advise: cultivate awareness of your physical capabilities and remain vigilant for any changes, no matter how minor they may seem. Monitor your ability to perform routine tasks, such as standing up from a seated position, walking briskly, or navigating stairs without support. Take note of symptoms like muscle fatigue, trembling, unsteadiness, or a tendency to lose balance during everyday activities. If you notice these changes, schedule a consultation with your primary care physician, who may refer you to specialists like a neurologist, orthopedist, or physical therapist for a comprehensive evaluation. Diagnostic tests, such as blood work, nerve conduction studies, or imaging, can help identify contributing factors, while a physical assessment can pinpoint specific areas of weakness or imbalance. Your healthcare provider may recommend a personalized exercise program that includes resistance training to build leg strength, balance exercises like single leg stands or Tai Chi to improve stability, and aerobic activities to enhance endurance. Physical therapy can provide targeted interventions, such as gait training or proprioception exercises, to address specific deficits. Additionally, lifestyle modifications, such as optimizing nutrition to support muscle health, managing chronic conditions, or adjusting medications that may affect balance, can play a significant role. By taking these early warning signs seriously and acting swiftly, you can prevent further decline, reduce the risk of falls, and maintain robust mobility and independence well into the future. Now, we truly want to make this knowledge actionable for you. Take a moment, right now, to consider what resonated most. Was it the importance of incorporating even small bursts of movement throughout your day? Perhaps it was the realization that your protein intake might need a closer look? Or maybe you're thinking about finally addressing that nagging foot pain that's been altering your walk. To help solidify your understanding and inspire others, we have a simple request. In the comment section below this video, please share just one specific thing you've learned today that you are genuinely committed to bringing into practice in your daily life. Sharing your commitment not only helps you stay accountable but also creates a supportive community where we can all learn and grow together on our journey to stronger, healthier legs. Your insights and experiences are invaluable, and we're eager to read what you'll be implementing. If you found this video informative and empowering, please leave your comment below, and don't forget to like, share this video with anyone who might benefit, and subscribe to our YouTube channel for more practical tips and in-depth discussions on senior health and well-being. Your support helps us continue to create content that makes a real difference in your life.